The Public Health Agency of Canada confirmed media reports just before Christmas that it had secretly accessed location data for 33 million mobile devices to monitor the movement of Canadians during COVID-19. That number represents roughly 87% of the population who were spied on without any knowledge that the government was accessing their data. Public Health Agency of Canada officials were forced to admit this had occurred after a request for proposal was published with a call for interest in continuing a program of collecting data for up to 5 more years.
We now know the name of the second company that helped the Public Health Agency of Canada scoop your private location data from your cell phone and then analyze it and give it back to the government. I can also tell you what sort of behaviors these two companies were tracking about you without your consent. You know, you may not know it, but Rebel News actually broke the story of the Public Health Agency of Canada tracking the cell phone location data of, well, basically all the Canadians who have a cell phone as part of their COVID behavior surveillance program. The way we discovered it happening was coincidental and slightly mundane. We were checking out the government contracts and procurements website the way we do almost every single day. And we saw a request for a contract for the continuation of cell phone data collection for COVID surveillance, which spelled out to us that the collection had already been happening, given that they were, of course, asking for a continuation. Ultimately, the Public Health Agency of Canada was forced to admit that they were indeed tracking Canadians without their knowledge and without their consent, like a bunch of Big Brother Orwellian peeping Toms.
The data, as said, is de-identified and aggregated, and I understand it doesn't mean a lot in and of itself. The level to which it is de-identified and aggregated, though, is quite significant. So effectively, for one data line, we have a table called percentage of time at primary location. And this basically represents the percentage of time that a cellular device will be at one place. Wherever it spends the most time is the primary location. The data set would say a date, so a single day, would give a province, would give a health region, or potentially down to a census subdivision, which is effectively a municipality. And then we get a percentage of time at that location. So, for example, in Manitoba, in a health region, you would have 91%. And we would know that for the aggregate, and that's aggregated time for the day, it's aggregated for an unspecified number of potential users within that health region. We would know that 91% of the time, that device stayed at its primary location, and we would use that as a proxy for movement and adherence with public health measures.
So we wanted to know how they got this information, which cell phone company was the co-conspirator here, the creep show collaborator, taking their customers' information, violating their privacy without their consent, and then selling it to the government for a profit, profiting off the violation of their customers' trust. We had previously uncovered through access to information that the Public Health Agency of Canada had paid TELUS Communications, the cell phone provider, $200,000 to retroactively provide cell phone tracking data all the way back to January 2019. You see, this way the federal government could use your cell phone data to show your regular habits pre-COVID versus just how compliant you were after they forced you to stay at home. Well, now there's one more company that I can tell you was involved in this North Korean style mess. We filed for information about where the government was storing all this data. And we were able to do that through your generous donations to our Paper Trail Investigations website at rebelinvestigates.com. We wanted to know who was storing our vital information about where we've been and who we were with, and how were they protecting our data. So we asked the Public Health Agency of Canada for the list of names and locations of all the databases being used to store the data pertaining to Canadian cell phone locations and related metadata as it relates to COVID-19 surveillance programs, such as the one mentioned in the procurement notice that the Public Health Agency of Canada had posted. That's the one that we saw and reported on. So let me recap so you understand why we're just so curious and a little bit concerned. Well, actually, I'm a lot bit concerned. The Public Health Agency of Canada asked your cell phone provider for your tracking information. Neither of these parties asked you. Neither party paid you for your information, but the Public Health Agency of Canada paid TELUS for it. And who's got it now? Who's managing this? And why should I trust any of them? What I got back, though, from the government was even creepier because it shows me what they were examining about our behaviors through our cell phone data. Let's take a look. Do you see this? It says this path contains all of our data that we received from TELUS on a weekly basis. It contains the aggregated data for the indicator of time spent away from your primary location. So they know how long and when you were gone from your house. Weird. Next, they break it down by health region. Same thing, time spent away from your primary location. Then they break it down by provincial level. So I guess they can see which residents of which province were the most compliant with their stupid rules. It wasn't Albertans, I promise you that much. Then they break it down by municipalities and whether you traveled between provinces. Now, the other company outside of TELUS that has your data is a company called Blue Dot. It calls itself the Outbreak Intelligence Platform, and I'm pretty sure you didn't give them access to your information either, but friends, they've got it. The company was founded by the University of Toronto's Cameron Kahn. Blue Dot says they use AI to predict outbreaks. Anyway, Blue Dot collected the same data about you that TELUS did, but it also monitored data containing visits to points of interest like parks, grocery stores, hospitals, long-term care centers, and retirement centers. And in addition, Blue Dot data contained information about devices traveling from the US to Canada at a municipal and national level. Did you consent to this? I don't recall that I ever did. And I don't know what Blue Dot data was paid for all of this, but I'm going to find out, and I need your help to do it. We are proudly independent and viewer supported, as you know. This means we're honest and beholden to no one, especially not Justin Trudeau. If you'd like to help make a donation to cover the cost of filing and researching the rest of this story, including Blue Dot's contract, please make a donation at rebelinvestigates.com. For Rebel News, I'm Sheila Gunn-Reid. The Public Health Agency of Canada paid at least two separate companies, TELUS and Blue Dot, to scoop your data, your cell phone location data, and then analyze it, and then give it back to the government. I want to know how much Blue Dot was paid for all of this, and if their contract is ongoing. To help me find out this information, I'm going to need a little help. Would you mind making a donation at rebelinvestigates.com? That's our paper trail and access to information research fund. Thank you in advance for making this important work possible.